Hello everyone, my name is Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. Keep learning, keep growing. Welcome back to another interesting video of Nursing Prometric series. This is the third video of this series. In each video, we are discussing 15 questions and their answers which will help you to prepare and clear your Nursing Prometric exams. And this is going to be of great help for all those nurses who are aspiring to work in any of the Gulf countries, so that you can obtain your professional license to work as a registered nurse in your dream country and begin a new journey. An interesting and very lovable journey. Okay, so let's begin. But before moving ahead, a small and gentle reminder to all my lovely and wonderful viewers that if you are new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. Okay, so let's begin. We are going to discuss 15 questions in this, so please concentrate. Now, in the previous two videos, we have discussed 30 questions altogether, 15 plus 15. In this video, we are going to discuss from question number 31 to 45. Okay, let's begin. Okay, so question number 31 here, as you can see. Okay, the question is sharp containers for dash. Yes, so sharp containers, as we know, it is to dispose of the needles and sharps. Yes, sharp container, which is also known as what? Puncture proof container. Yes guys, sharp container is also known as puncture proof container. It is nothing but it's a white translucent plastic puncture resistant and leak proof container which is used to handle, store, transport and dispose of the sharps, needles and blades. Okay, so and it is also labeled with the international biohazard symbol. Yes, so sharp container, which is also known as white PPC. Okay, it is used to dispose of the needles, sharps and blades. Okay, so that is what the answer. Then the next question, they have given the three options here. Which is considered as normal blood pressure? They have given three options: 90 by 60, 111 by 72, 136 by 82. So which you will consider among these three as the normal blood pressure? As we all know that the ideal blood pressure ranges from the systolic is between 90 to 120 mm of mercury, and diastolic between 70 to even 80 mm of mercury. Yes, usually the standard one we consider as 120 by 80 mm of mercury. Okay, so among this, the ideal one, I mean the normal blood pressure that we would consider is this one, 111 by 72 mm of mercury. This would be the normal blood pressure that we would consider among these three options. Okay, see, less than 90 by 60, it is quite low. Yes, it is not to be considered in healthy adults, and 140 by 90 mm of mercury is quite high. Okay, so 111 by 72 would be considered as normal blood pressure. Okay, then the next question, patient blood pressure is 142 by 88. What is the pulse pressure? Okay, so they have asked what is the pulse pressure. They have given the systolic and the diastolic pressure, and they want you to calculate the pulse pressure. So what is pulse pressure, guys? Pulse pressure is nothing but the difference between the systolic and the diastolic blood pressure. Yes, pulse pressure, it represents the force that heart generates each time it contracts. Yes, and in a healthy individual, the ideal pulse pressure is 40 mm of mercury. Okay, and so now how will you calculate here pulse pressure? As I said, it is difference between the systolic and the diastolic pressure. So the systolic pressure here is 142 mm of mercury, and diastolic blood pressure is 88 mm of mercury. So 142 minus 88 is 54. So 54 mm of mercury is the pulse pressure that you calculate over here. Okay, see, if the pulse pressure is like consistently 60 mm of mercury or greater, then it is likely to be associated with some disease condition of the heart. Okay, and if the pulse pressure is 50 mm of mercury or more, then it increases the risk of congestive cardiovascular diseases. Okay, and if the pulse pressure is low, then it is a sign of disorders like congestive heart failure. Okay, so pulse pressure is a very good indication of some underlying disease, so that's the reason they calculate it. Okay, and it is nothing but the difference between the systolic and the diastolic blood pressure. That is how you calculate it. Very simple. Okay, then the next question: when caring for a 3-year-old neonate who is receiving phototherapy to treat jaundice, what would the nurse expect to do? Which of the following thing? Okay, a 3-day-old neonate is receiving phototherapy for jaundice. Okay, so the nurse who's taking care of that baby, what she is expected to do? Which of the following actions? Turn the neonate every 6 hours. Next option is encourage the mother to discontinue the breastfeeding. Next is notify the physician if the skin becomes bronze in color. And the last one is check the vital signs every 2 to 4 hours. So what could be the right answer? The right answer is check the vital signs every 2 to 4 hours. See, phototherapy is very safe, but it can have temporary side effects including skin rashes and loose stools. Okay, so overheating and dehydration can occur if the baby does not get enough breast milk. So discontinuing the breast milk is nowhere a chance. Okay, it has to be continued, but the baby's vital signs, baby's skin, baby's temperature, and the wet diapers also need to be closely monitored. Okay, that should be the primary and the main role of the nurse over here. Okay, then the next question is: a patient presented with high fever, headache, vomiting and neck stiffness for the past 3 days, which of the following is the first diagnostic intervention for the patient? So they have given 3 signs and symptoms here, not 3, 4 in fact: high fever, headache, vomiting and neck stiffness. So what you suspect? Urine and stool analysis, okay, lumbar puncture with CSF aspiration, complete blood count, chest and abdominal x-ray. What would you suggest? Which diagnostic procedure would you go for? You know, what provisional diagnosis you have in your mind, and based on that, which diagnostic procedure you go for? So the right answer is lumbar puncture with CSF aspiration, and the reason is because you are suspecting meningitis. Okay, so as we all know, meningitis is nothing but an infection and inflammation of the fluid and the membranes that are meninges surrounding the brain and the spinal cord. Okay, so when this infection is there, you will notice, the patient will usually present to you with high fever, headache, vomiting and neck stiffness. Okay, so when you are suspecting meningitis, the patient is asked to go for lumbar puncture. They will aspirate the CSF and they will send it for the CSF analysis to rule out the cause, whether it is bacterial, fungal or parasitic infection. Okay, usually bacteria that causes meningitis, but it can be because of the other microorganisms too. Okay, fine. The next question, hope it is understood, guys. Okay, the next question: a newborn Apgar score at 1 and 5 minutes is 5 and 10. Apgar score. Okay, half an hour later the baby became bluish in color with heart rate of 140 beats per minute. Your first action would be, what would be your first action? The baby is turning blue. Okay, so they have given the options: estimate the score again, shower the baby with warm water, funny right, give oxygen immediately, ignore the finding because it is normal. No, not at all, you cannot ignore that. Okay guys, what is Apgar score? Apgar stands for A for appearance, P for pulse, G for grimace, A for activity and R for respiration. Yes, this Apgar score is a test, usually for the babies in their first few minutes of birth. We do this so that we can assess if the baby requires any extra medical care or emergency care. Okay, and the score is given. If the score is low, then extra medical care is needed. Okay, so when the Apgar score is low and the baby is turning blue, that means the baby is turning cyanotic. Then what would be your first intervention? It is to give oxygen immediately. See, the baby is turning cyanotic. That means the baby is not getting enough oxygenated blood throughout the body. Okay, the supply of oxygenated blood throughout the body is low. That's the reason the baby is turning cyanotic. So the first intervention would be to give oxygen supply, oxygen therapy. Okay, Then the next question, a 68-year-old woman diagnosed with thrombocytopenia due to acute lymphocytic leukemia is admitted to the hospital. The nurse should assign the patient to a dash. Okay, so what are the options? Let's see. To a private room, so she will not infect other patients and healthcare workers. To a private room, so she will not be infected by the other patients and healthcare workers. To a semi-private room, so that she will have stimulation during her hospitalization. To a semi-private room, so that she will have opportunity to express her feelings about her illness. See, they have given 4 options, and the right one is this, that is to a private room, so that she will not be infected by the other patients and healthcare workers. See, thrombocytopenia is low blood count. Okay, so when the patient is having thrombocytopenia, they are at increased risk of bleeding. Yes, so we know what care to be taken. We have to avoid many of the procedures, and other whatever the procedure that we are doing, we need to be careful, to puncture the patient, because they are at increased risk of bleeding from all their orifices. Okay, and even the skin integrity breaks. Okay, and acute lymphocytic leukemia, which is also known as acute lymphoblastic leukemia, it's a type of blood cancer of the blood and the bone marrow. Okay, which is most common cancer in kids. Even it occurs in the adults also. But when the patient is having this type of blood cancer, they are obviously on chemotherapy, and they are immunocompromised, and all the immunocompromised patients, they are vulnerable, and they should be protected by reverse barrier nursing. Yes, so that the other people and the healthcare workers do not infect them. Okay, so we are giving them a private room, so that she will not be infected by the other patients and healthcare workers. They are immunocompromised. Okay, because they are on the chemotherapy, and because they are suffering from this kind of leukemia. Okay, so reverse barrier nursing, that is this answer. Okay, this is the right answer. Then the next question is, a patient complains of severe pain, which he stated to be 9 out of 10. Okay, the pain score is 9 out of 10. The physician ordered morphine 50 mg IV every 4 hours, and the last dose was given 2 hours ago. What is the best action his caring nurse would take? Okay, see, a patient complains of pain, very severe pain, which is, the score is 9 out of 10, and the physician has ordered morphine, okay, every 4 hours. So what would be your action? Give another dose of morphine, inform the doctor to change the order, distract the patient by TV, radio or games for 2 hours, and ignore the patient completely. See, distract the patient, this devotional therapy will not help when the pain score is so high. And ignoring the patient completely, no, we cannot do that when the patient is in severe pain. Okay, and give another dose of morphine, no, because morphine is a very strong opioid analgesic, and it cannot be given so frequently like that. Then what would be the best answer? The best action that we would take is inform the doctor and ask him to change the order. Okay, that we can do it. Okay, so that will be the right answer. Then the next question is, which of the following is the best method report and issue to decrease confusion and irritability for asthmatic patient? See, when the patient, for an asthmatic patient, when they have that asthma attack, they have difficulty in breathing, and they are exhausted. Yes, so the best thing that we can do to help them is give antibiotic, give sedative, give vasodilator, or give oxygen. The best is to give oxygen. To give oxygen is the right answer. Okay, then the next question. On arrival, she had a severely decreased level of consciousness. Her breathing is shallow and irregular. The skin is cool, dry, and pale. There is generalized non-pitting edema of all the extremities and face. Okay, and the blood pressure is 70 by 40 mm of mercury. Heart rate is 60 beats per minute. Respiratory rate is 12 breaths per minute. Body temperature is 35.5 degree Celsius, tympanic. Okay, then what is the most appropriate method to rewarm this patient? See, considering all these signs and symptoms, you have to consider the patient's temperature. The patient is in hypothermia, okay, and which is not safe if it prolongs for, if it is like not taken care. So what is the best way to warm the patient, to rewarm the patient, is to cover the patient with the hospital blankets. Okay, they have given 4 options: warm IV isotonic fluids, place the patient in a warm bath, or apply heat packs to the head and neck. No, the best thing that we can do to rewarm the patient is to cover the patient with the hospital blankets. Okay, then the next one: during the evaluation at a community clinic, the patient completes the medical history. Which of the following is not a risk for an acute myocardial infarction? Okay, so you have collected a history at a community clinic from a patient. Okay, so which of the following is not suggestive of the patient is at risk for acute myocardial infarction? Coronary artery disease. Yes, when the patient is having this history, they are at risk of MI. So this is minus. Smoking, yes, this also poses a risk for MI. This is minus. Hemophilia and hyperlipidemia. Hyperlipidemia, high cholesterol levels, that is also a risk for having an acute MI. Okay, so the right answer is hemophilia. It has nothing to do with this cardiac history. So this is the not a risk factor for acute myocardial infarction. Okay, we have to read the question carefully. They are asking which is not a risk. Okay, 3 are the risk factors and the 1, hemophilia, is not a risk factor for acute myocardial infarction. So whenever we are answering, we have to read the question properly. We should understand what exactly they want to ask, and read the options carefully and choose the best one in that. Okay, fine. The next question is: adult patient complains of diarrhea, vomiting, abdominal cramp and pain, okay, within past 2 weeks, and the patient is reported that the pain is increasing when he is eating and relieving when he passes the stool. So which of the following would be the cause of this kind of signs and symptoms? The options are appendicitis, Crohn's disease, ectopic pregnancy, or cholecystitis. The right answer is Crohn's disease. As we all know that Crohn's disease, that is inflammatory bowel disease, yes, it is, the abdominal cramps are the most common symptom of this kind of disease. Okay, usually the patient will have that typical abdominal cramps, abdominal pain, which is very severe, and which is very severe, and usually they feel it in the right lower abdomen and around the navel region. Okay, and within 1 to 2 hours after eating they will have this pain. Okay, and even though their bowel is empty, still they feel like passing stool. Okay, so this kind of symptoms you will usually notice in Crohn's disease. Okay, that is inflammatory bowel disease. Okay, then the next question is the district nurse visits a 30-year-old woman at home following the delivery of her second child and a full-term girl. Okay, following a delivery of her first child, she had reported an issue that she developed a breast infection and stopped breastfeeding because of the pain. Now at this how the nurse can help her to best prevent this kind of problem for this baby. Okay, see, at first delivery, after her first delivery, she faced a problem of some breast infection, and because of the pain and discomfort she stopped feeding the baby. So to avoid such kind of problem in this pregnancy, what the nurse can suggest for her: to provide feedings on demand, apply vitamin E cream to the nipples, or request a prophylactic antibiotic, or apply heat to the breast after feeding. The right answer is apply heat to the breast after feeding. See, when they are having such breast engorgement and this breast inflammation, infection are usually common. Okay, so what they can do is, the best is they can apply some warm applications before feeding also. Okay, this will help the ducts to dilate, the milk ducts to dilate, and all the milk that gets accumulated and stuck in the ducts will come into the nipples. Okay, and then it will reduce the inflammation and discomfort. Okay, and then after feeding they can do a cold compress also. Okay, so that they can have bit relief and they feel better. Okay, so this can be done to reduce that inflammation and pain and discomfort with the infection. Okay, then the next question is measles isolation period. What is the isolation period for measles? Okay, the isolation period for measles is 5 days after the rashes appears. Okay, so 5 days after the rashes appear, the person has to be isolated. See, in measles what happened is, even before the rashes appears, 4 days before the rashes appears and 4 days after the rashes appears, these kind of people are they are capable of spreading their infection. Okay, so airborne precautions need to be taken because it is an airborne disease, and also they need to be isolated for 5 days after the rashes appear so that they don't spread the infection to the others. Okay, then the next question is rubella or German measles. What is the isolation period for rubella or German measles? Okay, rubella or German measles, which is often called as 3-day measles. Yeah, the isolation period is 7 days after the rashes appears. For measles, it is 5 days after the rashes appears, and for rubella, it is 7 days after the rashes appears. Okay, 7 days before and 7 days after also they are capable of spreading the infection. So 7 days after the rashes appears, they need to be isolated from others. Okay, so that they don't spread the infection. Okay, so here we finished with the 15 questions. Okay, hope it was helpful to you all. Okay, please go through. I don't know if the clarity is good and if you can read the options carefully, but I wish you listen with full concentration. I'm sure you'll be able to understand. Okay, these questions will be surely helpful to you in preparing for your Prometric exams, and the question can be from any part of nursing. All the subjects that we have studied in 4 years of BSc, they can ask from any subject, from any hook and corner. Okay, so we need to be prepared well. Okay, and we have to read the question carefully, read the options and choose the best one that matches. Okay, and that's it. Yes, so all the best for your nursing Prometric exams. All those who are trying, prepare well and write the exam well. Okay, so thank you so much for watching, and keep motivating me, keep encouraging me by subscribing my channel, by liking the videos and sharing my videos. Okay, thank you so much, and help others. When you understand the things, please help others also to understand, and stay down to earth, be cool, relax, and stay humble always. Okay, thank you guys. Goodbye.